as a health professional and as a growing health professional. So this is rooted in the social determinants of health that you heard about last month, and the conditions in which people live, learn, work, and play and pray. And as we age, the known and unknown situations that occur in developing disabilities or other chronic diseases. And so with that, we'll just get into it. So kind of the objectives are just to understand what salutogenesis is and the importance for health professionals. How do we apply salutogenic thinking and approaches to our work? I'm going to use the example of food security as a mechanism of salutogenesis, since that's in my area of research and community engagement. And also, how do we use that then to assess food security with the idea of redesigning it for health and well-being? And how we use anti-racist action to ensuring food security in a healthy population. So salutogenesis was developed 42 years ago in 1979 by a sociologist, Aaron Antonovsky. And he sort of introduced this concept, which is the complementary approach to pathogenesis. So we can assume that salutogenesis would be sort of the opposite or the complementary viewpoint. Apologies if my internet connection is a little spotty out here. All right, so salutogenesis, I was saying, is about the generation creation of health. And Aaron Antonovsky, sociologist, 42 years ago, developed this idea. And he leads with the question, how can we be moved toward greater health? And health being defined as physical, mental, and social well-being. He developed this because he was studying the survivors of the Holocaust and how they had just gone through such unimaginable torture in their lives, but then later on were found to be thriving and having a very high quality of life. And so in his model of salutogenesis, he has this idea called a sense of coherence, which basically just means that life is meaningful, manageable, and comprehensible, and that there is a sort of fidelity and a harmony to that. Antonovsky was definitely pessimistic, and because he knows that humans are flawed and we are inherently flawed. Everything, the second law of thermodynamics, everything moves towards chaos, entropy ensues, degradation happens unless we actively pursue a course of action to cause health to happen. And we know we can do this. So just like there are behaviors that we do, smoking and drinking, unsafe sex practice, sexual behavior, things like that we know could lead us to developing a disease or condition or issue with our health. We can do other things that are going to give us life, give us health. Things like making sure we are eating healthy, making sure we are exercising. And that's all at a very much individual level. But I'm going to talk about how we apply salutogenesis to a systemic level and an institutional level as well. So one little caveat in that salutogenesis is more than prevention. So prevention, if you think about it, if it works, nothing happens. But so more health and greater health and better health also doesn't happen. It just is a sort of zero-sum kind of issue or situation. And so salutogenesis really is about, again, pursuing a course of action to actively cause health to happen. And so this salutogenesis allows us to reimagine realities, redesign our local systems and environments so that quality life improvement can be fully realized, and we can discover how to live and move forward in a more higher quality way. All right, so across the globe, across the globe, health researchers and professionals are enhancing their work by attempting to answer the questions about what leads to better health, more physical, mental, and social well-being. And we know there are precursors that happen for health, and that not only enables us to help those that are currently sick and want to regain their health, but helps us to move beyond this idea of unsickness in better health or to better health. Salutogenic practices are ongoing in Europe, in Asia, and South America, but they're very rare here in America. Of the other countries and continents have had salutogenesis as a part of their health model and their healthcare model and health systems models for a long time. But for whatever reason, America just seems to struggle with this idea. And it probably has a lot to do with the way that we pay for our healthcare system, our healthcare and the systems of health. So the acceptance of the pathogenic model of health in America is the traditional approach. Where health professionals, disease prevention and treatment and or management of the past lead to better health. But does it really? And I beg the question, what can lead us to more health? So common sense tells us that the absence of a bad behavior does not indicate the presence of a good behavior. Research consistently has demonstrated that simply decreasing the negative outcome or the negative state does not mean that the positive state is going to increase. So health is similar in that its presence requires more than just the absence of disease or the related risk factors. The focus must be on our approach to strategies and environments to improve and advance and enhance health and the potential for health by facilitating measurable gains related to sort of the idealized or the optimized outcome. So there are efforts underway to try to rebuild the current US sick care or illness care system into a more effective and efficient healthcare system that would include those complementary salutogenic approaches. Like I mentioned, Europe has taken this approach. They've been practicing salutogenesis for about 20 years now across a lot of their healthcare systems because they've moved from treating ill health or sick health to really promoting and enshrining good health. And they do this through a multitude of strategies, cross-sector collaborations and partnerships. One example is in Rotterdam, Netherlands, where they were experiencing flooding as a result of climate change. They literally rebuilt the city to architecturally to absorb the flooding and the waters rather than try to just move people from the coastlines and migrate people away from harm. So they sort of embrace the water, and that's what salutogenesis really promotes, is being able to see your situation and say, well, what is this vision for greater health? How do we move people along that beautiful continuum of health and the potential for health? And so they've been actually living this out for the past 20 years in Europe. Salutogenesis can be the underlying framework for a redesigned healthcare system, as well as public health, or really any issue that we want to work on. And it just causes us to step back and think about, okay, what are the origins and the causes and the precursors to physical, mental, and social well-being, the behaviors, conditions, and factors that cause health to happen. All right, so the evolved health status of people in the Western world has led to good health becoming an expectation or an entitlement. And that is mostly because people can afford to be cared by a provider. And in the past, avoiding disease was seen as sort of an outgrowth of personal responsibility. But to kind of facilitate people being healthy or have a greater, higher health status, we have to develop new measures, and we have to be able to quantify positive health or that health potential. And that's really hard. And it's kind of difficult to wrap our heads around because it's not traditional, or it's not how we're trained. It's not something that's within our norms currently. And these measures obviously go beyond pathogenesis and measuring the burden of disease. And so we want to identify the qualities for developing and testing and implementing plans and practices that will enhance health and well-being. So Antonovsky offered 3 different ways to do this. He said, first, look at the data differently. So in my world, food insecurity and hunger are what are measured in terms of identifying individuals and populations that are experienced to having a very low access to healthy food options or healthy food sources. And so instead of looking at those who have succumbed to a problem, kind of to find out why, Antonovsky promotes looking at those who are succeeding and try to find out why they are doing well. So people who are food secure, well, what are the conditions and factors and behaviors that allow them to be food secure? And those are the things that we should start measuring. The second part is persuading practitioners and researchers and professionals to ask about the factors that are related to success, not just the factors that are related to problems. And this can be applied at an individual level, a community level, a population level, a societal level. And the third recommendation, or the third way to do this, is to stimulate the formation of a unique hypothesis generated to explain a specific or desired outcome, that idealized or optimized outcome. And so we're starting to see more research related to salutogenesis and salutogenic approaches that help to promote and develop positive health outcomes. And so to fully test this sort of a salutogenic model, this is an example. One study that was done in North Carolina was to design to find the factors related to top performers at a large university in North Carolina, using something called the Salutogenic Wellness Promotion Scale, the SWPS. This is a validated, comprehensive tool designed to measure health promoting actions in the physical, social, emotional, spiritual, intellectual, vocational, and environmental dimensions. So all aspects of health. And the scale has been used to determine factors associated with those optimized outcomes. And it showed significant gains, statistically significant gains among the college students in perceived health, life satisfaction, job performance. Those were all positive assets. And the study also showed that those who engage in a greater number of health promoting behaviors, health causing behaviors, have obviously lower levels of disease, depression, and other disease related symptoms. So in this one study though, the top performers at the university were defined as those that had a high grade point average and a high health status. So they had a high level of health behaviors that were leading to them being healthy. So the results of the study showed that students with the highest perceived health engaged in significantly more health promoting physical activity and nutrition behaviors, as well as being the ones who exhibited greater amounts of health promoting emotional management behaviors and job related performance. Also those who found their academic work inspiring and important and enjoyable and meaningful had the higher GPAs. So you can kind of start to see how these things relate to one another, and how not just physical activity and nutrition as a health promoting behavior, but also finding enjoyment in life and meaningfulness in life, promoted good work ethic and high GPAs and good job performance. So in my world of research, I look at local food systems and seeking to redesign the system, specifically in areas that are experienced to chronic oppression and discrimination and disadvantage, otherwise known as those labeled by the USDA as a food desert. I want to introduce some terms to you because food desert really isn't the best terminology. The Eat Lancet Commission advocates, this is a big commission, 37 expert leaders in food systems, food production, food consumption, got together in 2018, and in 2019 launched the Eat Lancet Commission report. And in the report, they said, food is the single strongest lever to optimize human health and environmental sustainability on Earth, and that food will be the defining issue of the 21st century. Their vision was a fair and sustainable global food system for healthy people and planet, leaving no one behind. So food sovereignty is really this idea of the right of the people to have an appropriate food source in their, that is, in culturally appropriate way, produced through ecologically sound and sustainable methods, they define their own food and agricultural systems. So we don't currently live in a world that allows us to have influence really on our food systems. Everything is determined by the market and corporations and the food producers and the government, who provide subsidies to those who produce our food. And so food sovereignty puts the aspirations and the needs of those who are producing food and distributing food at the local level, puts that at the heart of the food system and at their policies. And so food sovereignty is based on 6 kind of principles or 6 ideas that bring sovereignty to the forefront. And so food sovereignty puts the right to sufficient, healthy, and culturally appropriate food for people. Focus on food for people. Food is not a commodity that we're just out purchasing like a TV or a car or a house, right? Food is for people. And so it rejects this idea that food is just another commodity or component of the international agribusiness. So food sovereignty means we value food for people and for health. Secondly, we value food providers. We support the contributions and rights of those who are growing, harvesting, and processing food at that local level. So we're talking about small scale family farmers and migrants and indigenous people and other workers. Sorry, my blood sugar monitor wants me to check my blood sugar. I'll do that later. So we want to, through food sovereignty, we want to reject policies and actions and programs that threaten the livelihoods of the local food providers, that where maybe the larger international industrialized US food systems are trying to undervalue them or to move them out from being competitive in the local market. So we value food providers. Food sovereignty also brings food providers and consumers closer together. So we're looking at a proximity, putting providers and consumers at the center of decision making, protecting consumers from poor quality foods and unhealthy foods. Recalls are happening all the time related to animal meat products, or salmonella or something like that. So bringing the food closer from the producer and the consumer mitigates a lot of those issues. And also any inappropriate charitable food aid that's going on or what is coming into the community. A lot of grocery stores will offload things that they are not selling off their shelves and plop them right into food pantries or the food bank. I remember one time when I was working in Lynchburg, there's a very amazing organization there, the Daily Bread, and you'd go in and there'd be just shelves full of sheet cakes and just cakes and cookies and just not healthy things. So food sovereignty brings producers and providers and consumers together to create the opportunity for localized food systems. Food sovereignty places control over land and water and livestock and puts that control into the hands of the local food providers, who then can assert their right to share their resources as they see fit in socially and environmentally sustainable ways. Food sovereignty builds on the skills and local knowledge of food providers that seek to conserve and develop and manage localized food systems. A lot of indigenous people groups are reclaiming their land and relearning how to what their ancestors did to farm the land and bringing that cultural awareness and practice back into the social norms. And so building that knowledge and utilizing those skills, teaching one another how to sustain the local food system is part of food sovereignty. And the last part is recognizing the diversity, biodiversity that comes from working in nature and protecting the ecosystems and to improve resilience and adaptation, especially in the face of climate change as we are facing today. And so we want to value nature and the planet and its role in our food production. But what we're actually seeking to eliminate by intentionally focusing on food sovereignty and security is food apartheid. The food apartheid takes into account racism, income, ableism, geography, and other factors when looking for ways to end inequity and discrimination in local food systems and food environments. It recognizes that the systems in place are what make it difficult for people living in low-income areas to access fresh, healthy food and experience less chronic disease, lower life expectancy, and other conditions. So I'm going to tell you a little bit more about how food apartheid manifests in the food space. So individualism emphasizes that people should be able to solve problems and accomplish their goals on their own. And in the food space, individualism translates to a focus of helping individuals who have fallen on hard times over structural issues like poverty and are struggling with food insecurity and hunger. So puts the emphasis on them if they only knew better, or if they only knew how to do this or that, or navigate this system or that system. You need to vote with your fork, build it and they'll come. Plop the grocery store down in the community and they will surely come and buy the healthy foods. The pull yourself up by the bootstraps mentality. Well, if you don't have bootstraps to pull yourself up with, that's going to be really hard to do. The focus is on food charity. In the community I work with, there's easily at least 15 to 16 different organizations, unique organizations that are funneling millions of pounds of food into this small 3,500 population community each year. And then sort of this good versus bad foods. Well, it doesn't matter if it's good or bad, just eat it, you have food. And so paternalism, it involves interfering in an individual or community's ability or opportunity to choose and make decisions. And this has the objective of improving the welfare of individuals and communities, but it's often done without their consent. It's often done without really thinking about the belief that communities as they define themselves, and specifically communities that are primarily our Black neighbors, Indigenous neighbors, and other people of color, they can't take care of themselves, or they need solutions prescribed to them. We need to tell them what to do. That's a very paternalistic approach that we see in a lot of these efforts related to food system change and transformation. Neoliberalism is an ideology and a policy model that looks at replacing entitlements within the market-based solutions related to social problems. So in the food space, neoliberalism is really like rooted American ideal of personal responsibility. If you work hard, you're going to get there. Working hard, a good work ethic is going to solve your hunger. And it is the responsibility of the community to care for you and not your government. Now, one other concept that heavily influences the food systems in America and the food supply is called universalism. That's not on the chart, but I'll tell you a little bit. So this assumes that values are held by whites are normal and widely shared, meaning the ideals are grounded in white cultural practices. In the food space, universalism means that whiteness fuels and dominates the conversation on how and why the food system should be reformed. With organizations that are implementing projects or programming, there's a lot of sort of white assumptions. And as a result, food spaces are shaped by these white cultural practices. They inhibit the participation of people who are not white. And trying to create alternative food systems can bring constraint and conflict into a community because it doesn't meaningfully address the inequalities. So the industrialized food system begins at the point of production and farming and is undergirded by massive conglomerates of processing, packing, and distribution, all subsidized by the US government to put cheap, low nutrition food on the shelves. There is a reason why the salad and the water bottle at the fast food restaurant costs more than it does to get the hamburger and fries, because the government has already subsidized and paid for half of it. The outcomes of this industry continue to lead to low and very low food security. So understanding how food systems and food supply impact community and population health is measured through food security. That is our measure. And so we use the salutogenic term as security because that is the outcome we're seeking, to create and generate sustained security. So remember, pathogenesis keeps us using words like food desert and food insecurity when we really want to build up the idealized outcome of sustainability of the local food system for household food security. So people are afforded the resources that they need to have a healthy food supply. And these are based on 4 components: availability, access, affordability, and proximity. So when we look at food availability, it's sort of this composite of production, distribution, and exchange. Production is how much and what types of food are available through local production, how food is made available or physically moved within a certain geography, in what form is it moved in, and when and to whom. And then the exchange is the available food available for some kind of barter or trade or purchase. Bartering and trading food used to be the economy of food 100 years ago. But the market and the corporations and the government have decided what is the food is available to us now. All right, so access means that we are focusing on the allocation and the preferences. So allocation determines or is determined by the economic, social, and political mechanisms governing when, where, and how food can be accessed by consumers. So preference is the social, religious, and cultural norms and values are related to certain types of food. You'll find differences in food products as you travel across the country. You know, from this state to that state, you can find different types of things. Affordability, really, this is the purchasing power of a household or community relative to food prices, which food prices are starting to go up. There's supply chain issues, COVID-19 pandemic has impacted it. So, you know, when you see that ratio of food prices to wages, you know, start to tilt, the balance starts to tilt, then we know that food is going to become unaffordable to a lot of people. And then the last thing is proximity, which relates to the geographically defined area in which good quality, nutrient-dense, fresh food is easily bought. And so those 4 aspects of security allow us then to measure whether households have high food security or on the continuum to very low food security. And over COVID-19 pandemic, we have come to realize that there are even more people now experiencing very low food security. So last year I was selected by the Robert Wood Johnson Foundation as a culture of health leader. And this leadership program is related or requires us to identify a strategic initiative, and one that really recognizes an injustice, is seeking to change the status quo, give voice to the issues that sort of incite civic leadership, partnership, coordination, and innovation. And so I have decided that I'm going to focus on food security and thinking from the question of what if we redesign the food system at the local level using salutogenesis as the mechanism and just reimagine this next era of food systems to kind of create new realities that bring better health by design and default. Public health's role in food systems is to ensure food and nutrition security. So people are getting the right amount of foods, as well as the nutrients they need to have a healthy body. And that the food environment is working toward all people's long-term benefit. So it is important to remember that we are informed by data. We rely on collective impact and community dialogue so that we can get more health. We want more health out of this. And we're going to leverage and enact local food production and sourcing, food source stability, and improved healthy food consumption by the community. I love this quote by Dr. Planey. She says, racism is a root cause of the social arrangements that allocate life to some and premature death to others. It's a heavy quote. As you know, in February of this year, Governor Northam and the Virginia General Assembly declared racism as a public health crisis. The American Public Health Association tracks these declarations across the country. And as of today, there are 217 cities and countries across 41, counties, and across 41 states. So almost the entire country have passed a racism as public health issue declaration. So localities and organizations, are calling out racism as a fundamental cause of poor health outcomes. And so my question and advocacy to you as a growing health professional is, how can we use salutogenesis for racial justice and anti-racism? A food secure community means that every household has the resources afforded to them as any other part of the community or locality. What's good for one end of the county is good for the other end too. And how food security is attained in each community might look very different. And that's perfectly okay if you're redesigning the local food system so that it is tailored for the community as they have defined what they need in their food system. So I'm going to propose sort of 4 ways that you can, as anti-racist action, that you can also employ in your own work as a growing health professional. The first one is collective impact. So real briefly, collective impact works on social problems to bring about systemic change at the population level. There are 5 components that help give us a framework for working together to pursuing that social change. It is based on a shared or common vision. So everybody is not shelving their agendas, but they're coming together to blend and merge and see where there's alignment and consistency related to the agenda that they want to achieve. That comes through authentic engagement with the community as leaders, and the community are the leaders and the experts, and recognizing that brings forward an anti-racist impact. We all want health equity, that it does undergird a lot of our work as health professionals. Oh my goodness. And it takes all of us working together, which is that sort of collaborative, ongoing communication impact principle. So we have to have a coordinated and mutually reinforcing plan, right? So we can't go off and do things. We're going to pool our resources together and we're going to see where we can benefit one another. So it might move you forward a couple of steps, it might move me forward a couple of steps, but everybody's moving forward toward that common agenda. The third one is about the intended outcomes, right? So salutogenesis is saying, hey, what are the good things that causes health to happen? Let's make those the intended outcomes, and then seeks to move the action toward that. Then we guide and advance strategy, policy, and environmental changes, related to the shared measurement of what we're looking to actively document and provide evidence that health is being created and generated from the activities. So too often, unfortunately, in a lot of my work over the years, it's the usual suspects of health that come together to try to work on a community. So very kind of medical mindset, like coming into a community to prescribe to them, to tell them what they need to do. And that continues to disenfranchise and marginalize people groups who have just been experienced to this their whole life. It's been their whole lived experience. And so the aim is really employing a collective impact approach to create anti-racist systems, policies, and practices as a part of those mutually reinforcing activities. The next one is on being data informed, right? So data is really important, and it helps us, but quantitative data doesn't tell us how and why. And we want to make sure that we are grounding it in a real life context of those lived experiences. The richness that we get from having a conversation from those that have been negatively impacted their whole life long, or experience poor health outcomes at a very early age is just tremendous data. And so it's important that we highlight the impact of healthcare inequities and their associated less than optimal health outcomes. But if we don't step back and understand how structural racism informs social determinants of health and those lived experiences, then we are missing the boat. We are going to be so off in what we plan or do. It's going to be a waste of time and money. So collecting qualitative data is also very important, because you're going to be able to understand multi-level determinants, understand individual beliefs and preferences. You'll be able to then guide effective organization and communication of services, right? Because the goal is building trust. And a lot of people in our communities and in our healthcare and hospital settings, they just don't trust the systems because we haven't given them a reason to trust. So once we, as anti-racist health professionals, know what the data informs and how we can utilize assets and resources, we can help champion indicators for interventions that further promote an engagement with policymakers and providers and others in the community towards salutogenic practices and approaches that work for the specific population that is being served. The third sort of process in anti-racist action is the community dialogue. And if we want robust community dialogue with those affected by oppressive systems of disadvantage, racism, and injustice, we have to listen to what they're telling us. When they say we need this change or that change, or us acting accordingly is practicing anti-racism because we don't inherently know their truth. Our implicit bias can cloud our ability to hear it. And community dialogue is going to offer an approach to collectively understand their words and their behaviors and apply them to examine, sort of faulty characterizations or even condemnation. So we listen generously through community dialogues, we give our undivided attention to them, and we seek to understand how they've been impacted by structural racism within the systems. So true community dialogue is going to lead to a healthier community. I've seen this happen across my career multiple times. It can be healing and regenerative, and the outcomes are that much better because of it. So we create that safe space for dialogue and respect. People speak one at a time. You're tough on ideas, but not on people, so that everybody ends up being responsible for the success of the dialogue. Civic leadership and ownership. The reality is that racism is fundamentally why many of our Black neighbors don't have enough to eat. Decades of discriminatory policies in housing and in other aspects, areas and sectors of the community have led to poorly funded schools, higher unemployment, low home ownership, and even worse, deplorable access to food. So it's really no surprise that double the number of Black households face very low food security as compared to white households. The staggering economic effects of COVID-19 have made it worse, as I mentioned before. So the last element of this action plan, I skipped. Sorry, so real quick, civic leadership and ownership, right? So this is about changing how resources and power are distributed and creating a healthy food system and healing and improving the quality of life. That is the intended idealized outcome. So we have to, as professionals, the key point here is releasing our power. We might know a lot, and we might be trained to know a lot and to do a lot, but the expertise resides in those that are going to be the beneficiaries, or those that are going to own, from a sustainability perspective, own the health causing actions or interventions that are going to be employed. So we need to let the community learn how to lead, to mobilize their own resources and people, to move from talk to action, and to create the right structure for transformation. Now we can talk about dismantling systemic racism. So it's really, really important to disrupt these systems and structures and institutions that are not working for a large portion of our population. We know systems are strongholds in protecting the status quo and perpetuating inequities. We talk so much about identifying the disparities and the inequities. We know where they exist. So we have to bust up the systems and the institutions. This is monumental work, but now is the time for this work. We can't wait anymore because we have to cause health to happen. Some people will say, well, the system's not broke, but why fix it? But who is it broke for? And the current food systems right now, 23.5 million Americans have low or very low food security. 23.5 million Americans. The dynamics of power, money, and law and politics significantly influence the types and rate of anti-racist change that any health professional or health profession system, public health, healthcare, hospitals, or institution would consider implementing. So as health professionals, we have to advocate for the upstream where we help healthy people to stay that way. We want healthy people to stay healthy and focus on the improvement of the conditions and factors that generate and create health. And so it's important that we center on healing our food systems as well as a part of this through sovereignty, security, and sustainability, and dismantling the racist structures and institutions. So there's an unlearning to relearn kind of process that happens where we integrate that new knowledge that we've learned by listening generously, engaging in community dialogue, understanding the qualitative data, and we start to incorporate that into our systems and institutions. All right, so it is very clear that racism results in inequitable health outcomes at the individual level. However, we want to be about that higher level look. We can't practice anti-racism on our own or in a silo. It just doesn't work. We can seek to eliminate inequities in healthcare settings, public health, et cetera, by investing in marginalized and chronically discriminated communities. But it goes back to collective impact. We have to have mutually reinforcing action at the structural and institutional levels and be guided by community influence and public policy level changes to kind of shift that course forward towards systems of care that focus on health, physical, mental, and social well-being. So because racism and our food system have evolved, co-evolved, our work is focused on building a fair, just, and sustainable food system that works for everyone. So to become anti-racist, food system actors at all parts of the process must understand how white supremacy, culture narratives function within the system, and then we seek to decenter that across the system through the food sovereignty framework. So you can see there reiterated the 6 aspects of food sovereignty and the 4 aspects of what a salutogenic, sustainable food sourcing, permanent food source would be rooted in: proximity, affordability, access, and availability. All right, so past and present political and social influences determine food access and control by design and default. Malik Yaqini is somebody you want to look up. He is sort of a food activist that I kind of fangirl over, but he writes a lot of really amazing things. And one of the things he says is public policy and economic practices have created these areas that have low access to food. And he adds, the struggle of food justice has to be tied to the struggle of economic justice, because there are policies and practices that can be put into place to create areas that have high access to foods. And it's really just then a game of economics. And that game has been fueled by racial and class discrimination. So solutions have to address the economic justices as well as this long history of discrimination. Can't simply plop a grocery store into a community, again, expect everything to change. That's not going to work, and that's been shown to prove that it doesn't work. Justice for communities that have been denied food security has to start with understanding how we make food, healthy food sources, more proximate and available and affordable and accessible. So redesigning the local food system with the intention and the purpose of that idealized outcome to create and generate more physical, mental, and social well-being will lead to improved health outcomes and higher life expectancies. And the reason we know this is because the existing food system perpetuates disease and disparity. So in closing, your reflection point questions are here. How can we create and generate health that is more physical, mental, and social well-being with individuals, communities, and populations? If we really sought a different outcome for better health through food security, what would that look like? And how can we move toward greater health rather than merely limiting or reducing the impact of disease or disparity? So this is really a new era for health professionals to lead change for a culture of health, a culture that desires to develop and test and implement plans and practices that create and generate health, especially in communities that are historically oppressed and discriminated by racism. We have a lot of work to do, and it feels daunting on a lot of days, but I hope that you'll join me in championing salutogenesis and anti-racist action when you are in your careers and going forward in your communities. So, questions?
You can see I kind of had a running conversation with myself as you were talking.
Excellent. Sorry, I am just pulling that now. Let me stop sharing.
No, hopefully everybody was reading it, what I was commenting on, because I was really just trying to connect a lot of, half of the students who are with us today are taking history with me this semester. So I was just trying to connect some of that, to the things that we've talked about so far. We've made it to about the 19 teens thus far in history. So a lot of focus on industrialization, and massive companies and corporations and the impact that has on people. And clearly we're still dealing with those kinds of challenges.
Yes, because the agrarian way of life originally, and when you look at the first settlers and colonists to America, it was local, right? Local sourced food, right? We didn't have these massive industrialized food systems, government that's subsidized by the government, right? Telling us what to eat and how to eat, right? And the crazy part about our food production is that literally 70% of it goes to animal feed. It doesn't even come to us as humans to eat, is what's being grown right now in the United States. Let me touch base on some of these questions. Why does it happen in Europe and not here? Private, yes, definitely. There are public there's public health care, in Europe. And I think there's also an appreciation for food as fuel and food as enjoyment, not food as a commodity, right? What we often go to buy what's quick and convenient and cheap. And so what we have proximate to us is what we're going to eat. If you live in an area where fast food density is really, really high, chances are you're probably going to eat a lot of fast food. At least that's what the research says. And then have those negative health outcomes from that. So Europe, culturally speaking, has just a different idea about food intake and food consumption. Food charity, yes. So Dr. Martin talked about a food program and how it caused diabetes. Previously, so Carl's chronic disease, yes. Unfortunately, love what the food banks do, love what food pantries do, but often they do not have healthy, nutrient-dense food sources, food supply. And so when you have a lot of labeled food desert areas have this network of charitable food that's just, poured into the community. And yes, so it's feeding disease, it's feeding unhealthy, putting unhealthy food into bodies, which then leads to disease, right? So the converse has to be true. At least that's what I believe with salutogenesis, is that we give people the opportunity, the proximity, accessibility for healthy things, locally grown things, regionally grown things, then health would be created and generated. And then yes, industrial food. If you this is like a new topic to you, I highly suggest Michael Pollan with the Omnivore's Dilemma and In Defense of Food. There's a ton of other documentaries out there, but really tackling, Weight of the Nation is another one that was done, a HBO documentary about our industrial food system and how that impacts human health. All right, how do things like SNAP benefits fit into helping people who don't have enough food to eat but are providing healthy food? Absolutely. So SNAP in the last year and a half has actually skyrocketed the number of families who have enrolled on SNAP, which is awesome. And SNAP dollars definitely have filled that gap in this emergency situation, right? So SNAP is meant for emergencies. It's not meant for obviously long-term. So it's a fix, it's a help, it's a great government program, but it's not fixing the root issue, right? It's not changing the food system to provide what people actually should be eating from a health perspective. And so the American Recovery Act, the CARES Act, all the funding coming from the federal government over the last year and a half have provided, free meals, the pandemic EBD cards to even families that school, like City of Norfolk, for example, all families got the pandemic EBT cards with preloaded with dollars that you should go to the grocery store, buy your groceries. And that's awesome. That's great. It did help a ton of people. We didn't see huge changes in, as the data has come out, we haven't seen huge changes in people, more people becoming very low food secure because of that help. But eventually that help's going to go away and it's going to return back to the normal or what the law says the enrollment can be based on their funding. Congress says is their funding amount, so they can only feed so many families, right? So there's this issue, like I said in the beginning, food is going to be the issue of the 21st century, and figuring out how we can redesign our local food systems to bring control to the localities. And I'm talking even populations, 3,500 people, 5,000 people. I'm not thinking about whole city of Virginia Beach, city of Norfolk. However, that could happen, right? The city could say, well, we've got 27 full service grocery stores over here. We have 0 over here. What if through economic incentives and policy, we said, okay, 27 grocery stores, you have to take 1% or 2% of your inventory and put it in a satellite location that we're going to set up over here and have it run by the community. So it creates jobs and people now have access to healthy food, right? So there's things yet to be uncovered and implemented and done to kind of get away from government subsidy, just filling the hole, filling the gap. Okay, so like a prescription for like a fresh farm, like a farm box or something like that. Is that what you mean with the pharmacy?
Or just giving people prescriptions of things, yes, that maybe are delivered to their house. Because I can think of, like, in a large setting, obviously, would something like that work better?
Yeah, actually, I mean, so that's bringing food to a proximate, place, right? My doctoral research was looking at elementary school teachers in Title I schools that have the USDA fresh fruits and vegetable program. Why this isn't totally generalizable, it did tell me that teachers involved in the program, which was meant to benefit the students, they had higher intake of fresh fruits and vegetable because it was provided to them 3 days a week. So they were getting their dietary guidelines for Americans. They were meeting the goal for the number of combined fruits and vegetables per day because of that program. It was proximate to them, right? Think about your own food supply in your house right now. What do you have access to? Is it cookies, candies, ice cream, all the fun things, or are you stocking things in your food supply like strawberries and bananas and apples and broccoli and blah, 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 right? So what we have access to in terms of supply is what we eat. And that's why proximity is really important. So yes, food pharmacy programs have had a benefit. It is meant to bring healthy, restorative, regenerative nutrients into the home, because otherwise it wouldn't happen. Fresh fruits and vegetables are really expensive compared to, everything made from corn and soy. I was reading an article the other day about Illinois and Iowa, that the farms, corn and soy farms in Iowa and Illinois, like 90% of them are growing corn and soy for animal feed. And the other 10% is subsidized to go into like ultra processed foods, everything that's packaged and sitting on a shelf in the middle of the grocery store. All right, college campuses. Are you meaning like gardens or edible vegetation? Or
how do, like, I don't know, students who are here, do any of you wish there was more access to fresh and healthy foods on campus? So how do they try to fix it? How do they get involved?
Yeah, so most of the food that is provided and proximate to you on a college campus probably results from a vendor contract, with an approved vendor through the Commonwealth of Virginia. And that's what drives their selection, not necessarily the nutrition and food security aspects of what is provided and available. So yeah, I think you can take encouragement from other college campuses that have really taken this to task. I know that some other larger universities in the state have weekly farmers markets, or they have grocery buses, specifically taking students to the grocery store who may not have transportation. There's a lot of things, a lot of strategies that can be employed at different levels as well. Even putting nutritional values on the boards, or giving students more information to make more informed choices related to what they're eating. So I know some colleges do a really good job with like allergies and other food intolerances and insensitivities. And certainly like people like Michael Pollan would recommend maybe stay away from the ultra processed, high fat, high carb type things. He's if we can move more of our population to a plant-based diet, say maybe 50 to 60% of your diet is plant-based, the impact on our climate and our environment is going to be super impressive. In fact, countries are starting and cities are starting to look at this as a goal. So fits in with the salutogenic thinking and approach. Amsterdam this week said that by 2030, they want 60% of their population eating 50% plant-based diet. So it's interesting. This is definitely a growing issue, a growing topic, because food is not a commodity. Food is for health.
A lot to unpack there. I keep talking to students about how we're drowning in plastic, but I think we're also drowning in meat, which is also, right? So that'll be the next thing I talk about in class, students. Drowning in meat, eat more vegetables.
Right.
Do y'all have questions for Dr. Hoglund? She and I can keep going back and forth all night. Nobody really wants to do that because we're all tired and it's been a long night or been a long day. Most of y'all had a chem test today. Hope your chem test went well. Yeah.
Go to bed early tonight. Make sure you get enough sleep. That's salutogenic.
Awesome. Well, thank you very much for answering all my questions and for talking to us about some solutions that hopefully stuck in your brains, students, and you have something maybe that you'll become passionate about and want to work on, like Dr. Hoglund is doing, because you can make a difference too.
Yeah.